Well, the number of employees in organisations citing mental or psychological health issues is increasing significantly. Well, to discuss the implications of this, Joydeep Hor from workplace law firm People and Culture Strategies joins us now. Joydeep, good to catch up with you again. Now, of course, we're all encouraged to talk about mental health. Is that the case in workplaces?
Yeah, increasingly so, and I think it's an area where, at a societal level, there's been so much progress that's been made, and as you say, generally speaking, it is far more acceptable. It is in fact encouraged at a whole range of levels for people to be a lot more open about any mental or psychological health condition. The way that's translated into a workplace context has been interesting, because I think we see a lot of employers trying to replicate that societal shift and supporting things and initiatives such as Are You OK Day and a range of other things. But understandably, there is still probably a greater level of stigma for someone in a workplace context to share with their employer that they have a psychological health issue or a mental health issue, because that propensity or willingness that has been generated at a societal level carries with it some different implications when you make the same disclosure or revelations to your employer. Naturally, you're understandably going to be a lot more concerned about what the ramifications are going to be. Will I be considered as someone who's less able to do my job? Will my manager start treating me differently, thinking of me differently? Is there something that's once shared is going to brand me and label me for all the time that I'm here? So there is still a lot of work to do in a workplace context, and probably more in the real proper direct conversation piece between employee and manager in this area.
Yeah, so is it perhaps more likely, Joydeep, that an individual will seek help outside of the workplace because they are fearful of how it will affect their career prospects?
That's absolutely the case. And often I think one of the challenges that employers face is often the time at which a disclosure is made to them about a mental or psychological health issue from an employee is at a time when the employer or a particular manager or leader in that organisation might be working through some concerns, for example, in relation to performance or output or productivity with the particular employee. And it's that acts as the catalyst for the employee to share with their manager and the employer that, well, actually, I have this particular condition or I have these particular conditions, and that's often presented as a justification or factor that needs to be taken into account. And the problem is, if you're not sharing that in calmer water times, if I could use that phrase, then naturally there's a level of colourability and perception, rightly or wrongly, that, well, you're only presenting this opportunistically, and if it really was something that you had as a condition, why haven't you told us this before? But of course, as you say, the reality may well be that an individual has been seeking support and treatment and assistance outside of the workplace context and has felt that that's something that they're able to manage. And it's only when a performance issue or productivity issue is being raised with them that they feel that they need to share what's happening with them from a mental and psychological health point of view.
So what mechanisms, if you like, should an employer have in place to deal with the prospect that employees will suffer from mental health issues? I would imagine it really depends on the size of the firm.
It does to a certain extent. I think, as we know from a range of contexts, the larger the employer is, the more resources that they're going to have at their disposal in terms of individuals who might be sitting within human resource or people and culture teams. But I think that the essence of good management around this particular issue for any employer comes down to the willingness, transparency and openness of a leader within that organisation to create that space with people who report to them around this is something that their team members can speak to them about confidentially, and that the manager will be there to assist them, of course, having regard to operational needs and everything else. That's regardless of size of the employer. I mean, any leader can be a good leader anywhere. They don't have to be working in a mega organisation with access to a whole heap of resources. A lot of this comes down to integrity and goodwill on the part of individual leaders. So I think this is something that's very doable regardless of the size of the organisation. But the creation of that trust between leader and employee is very important and takes time and takes work.
What does an employee do if they feel as though it is actually the workplace, the work they do, that is contributing to their breakdown in mental health?
And that is very often the case. Now, whether that is factually the case or not, or whether that is something that is perceived to be the case, is something that may be the subject of scrutiny and judgment down the track through a workers' compensation claim or whatever else it might be. But certainly, if any individual is feeling that, and certainly if they're getting information and advice from those who are treating them medically, be it a psychologist or psychiatrist, counsellor, whoever it might be, that work may be contributing or exacerbating a condition, that's something that they should be absolutely speaking to their employer about, and preferably doing so early. And I think it's always better when an employee is doing so, not from the perspective of being accusatory or adversarial, but in the same way that employers and leaders should be working with employees, employees should be working with their employer around something like this. So it's about transparency on both sides. If it is the case that an individual feels that this is something that's being caused or contributed to by the work or the workplace, it's something that they should share with their employer and see whether a process can be enacted or initiated whereby these matters can be properly addressed, if that is at all possible.